Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle. With your host, plastic surgeon Dr. Bruce Hermann. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Happy Friday, everybody, and welcome to another episode of Nip Talk. I'm your host, plastic surgeon Dr. Bruce Hermann. For all those watching live or on recording, we thank you very much. Please crush that like and subscribe button. We really appreciate it. With me today is my host, co-host Sarah Bennett.
Hi.
How you doing, Sarah?
I'm good.
And in the box, as always, we got Travis. How's your week been, Travis?
My week has been good. How about y'all?
It's been great, really
Pretty.
good. Any exciting things happen for you this week, Sarah? Typical work week?
Typical stuff.
Yeah?
Typical stuff.
Yeah, I had a pretty quiet week as well. Definitely work, but nothing out of the ordinary, just kind of standard stuff.
I did buy some new men's stuff for my store.
Did you?
So I'm excited
I might have to
about
stop
that.
by and check it out.
Yeah.
Yeah, I
I'm
definitely
excited.
will. Yeah, that's cool. I am doing something a little interesting this coming weekend. Did either of y'all do the immersive Van Gogh exhibit when it was in town?
Definitely heard about it, but I have not gotten to go.
Yeah, I had a lot of friends talk about it, but I haven't gotten to go either.
So the Van Gogh happened, that one was last year, and so we went and loved it. In fact, we sat through it a few times. I brought a little clip of it that we can show Travis, which basically what it is it's Van Gogh's paintings, and they're like living and moving on this massive screen, and it's set to music, and I didn't record the music here, but it's like all around you in this like almost like a room that's made of screens.
It's really great.
Yeah, it's beautiful, and you can buy drinks there, so you can have drinks and watch it, and it runs about 45 minutes, and there's different rooms and different like sizes of rooms that you can watch it in, and we really enjoyed it. We had a great time, and when we were there, we even said, I would love for them to do Monet, because I don't know if you guys are into classical artists, but Monet does a lot of impressionist type paintings. Right. They're very colorful, and it's almost similar to Van Gogh in the color scheme. And so, sure enough, they've come out with an immersive Monet.
Really?
So that's here in Dallas right now. And it's not just in Dallas, it's like in lots of cities all throughout the country.
I'm gonna have to check it out.
That's dope. Yeah. I think you just gave me a good little like date spot.
Dude, totally, man. And
Who are you gonna take on a date?
I don't know. I have to figure that part out. You just put me on the spot. I'm not gonna lie. I have to figure that part out.
But no, it is a good date thing because they have like a little bar there, and you can go and you get drinks and you sit in there and you can watch it. And it lasts about 45 minutes, and like it's so much though that like we sat through it 3 times. Now, we probably would have just done it twice, but we had dinner reservations, and we were just like, well...
Waiting around.
Yeah, waiting around, but like we totally enjoyed it 3 times, and we went to different rooms, and it's fantastic. So we're gonna hit the Monet one this weekend, so I'm pretty excited about it. I'll take a couple of video clips just so you can guys...
What part of Dallas is it in?
So it's in downtown. There's a name. Now you put me on the spot.
My bad.
No, it's totally cool. Like, there's a special building. It's like a historic building that it's in downtown. Kind of over there by like the book depository area, so like really downtown,
right.
Like or maybe like lower uptown.
I think I can find it from there, downtown Dallas. That should be simple enough. I got you.
Yeah, if you Google it, like you can find it. It's pretty. There's a lot of stuff out there, and it's not just in Dallas. Like people watching from other cities, like if you live in a larger metroplex, then
definitely heard about it. I've seen people post about it all over social media. So.
Yeah, and I think they're actually already planning a 3rd one that's like immersive, like Egypt, or immersive Tutankhamun, King Tut. I guess something about Egypt.
Nice.
Which I think it'd be interesting. Like I said, it's not like a life-changing event, but it is totally fun for like a Friday, Saturday night, a date thing. Even if older kids might enjoy it, if they're if they like art at all, or just even seeing the colors in the music.
Yeah.
So I'll definitely have to give you guys a full report. I'm excited to check it out.
Absolutely.
And Travis, I want to hear about that date that you go on.
Yeah.
I got you. I will definitely keep you updated.
You definitely got to take some pictures. Okay, so I wanted to start with our first segment, and this is coming from a question that I get in my office all the time. people will come in and they'll have issues with their body, whatever they might be, and people want to know, is this issue something that I can fix on my own with exercise or other methods, or is surgery my only option? So for today's Plastic Surgery 411, we're doing, can I reshape my body?
Hey, that's me.
It is you. I know, isn't that cool? It says, can I reshape my body after pregnancy without surgery? So I want to kind of go through some of the things that can happen, either through pregnancy or weight gain, weight loss, because that is a very similar effect on the body. And we can kind of educate people on what you potentially could fix yourself or what you might have to get help from. So I do get a lot of people coming in with questions about their breasts after pregnancy. I feel bad for you girls. You really got like a raw deal because you have to carry the children, and it really kind of affects your body in a negative way. And
takes over your entire body.
Yeah, totally. And there is some variance in that. Sometimes people will ask me, I'm gonna have a baby. What can I do to try to limit the effects? And there are things you can do. Like most notably is just not let your weight gain get on the extreme side.
Yeah.
I mean, I would never ever tell anyone, don't gain weight in pregnancy to to protect your body, because obviously the baby's health is most important. But that being said, there are scales of how much you can gain safely. And so, where I see people that get the biggest negative changes to their body is when they get a pretty rapid weight gain that's kind of above and beyond what would be considered a normal amount for pregnancy.
Right.
Because some people get pregnant and they're like, it's almost like, okay, well, this is my time to eat whatever I want because I want to have the weight.
I definitely had my days like that when I was pregnant.
Did you?
Yeah.
Well, yeah, because you get these cravings and like
Yeah.
you're uncomfortable and it's like comfort food.
I literally gone to Schlotchke's one time and just bought one of those large sandwiches, a cinnamon bun, potato soup. I ate all of it and then I fell asleep. Like that was like a normal once a month thing, I swear.
Yeah, yeah, and I feel for you because
Like a bear.
my wife had 2 pregnancies and she was uncomfortable and having food is kind of comfort, right? And you're expected to eat. But yeah, I mean that is one thing people can do. But kind of going from area to area, people ask me about their breasts after pregnancy and can I fix this on my own? Because some of the issues that people will sometimes bring up to me is, well, I really liked, my pregnancy breasts, and is there something I can do on my own to restore that? And unfortunately, the answer for the most part is no. I mean, there is truth to the fact that if you gain weight, that your breasts will get larger, but when you're pregnant, the breasts gain weight at a bigger proportion. So you gaining weight just, out of pregnancy is probably not going to give you that result that you want. And plus, it's hard to encourage people to put on weight purposefully to get larger breasts. I mean, because it's one, they're probably going to be disappointed, and 2, having too much weight is certainly a little bit detrimental for your health. The other thing about breasts that people ask me about is, I've had some sagging, because the breasts get large, they lose that weight, and the skin starts to sag, and people will ask me about, well, is there any chest exercises I can do? You're in the gym a lot. People probably talk about this.
They do, but most of the time, I mean, the only thing I could think that would help would just be perkiness, but
and that's a good thought process of, okay, if I exercise my chest, will that help with the perkiness of my breast? And the answer is kind of no. Having a larger chest muscle does play into the appearance and size of your breast. However, above that chest muscle, you have the breast mound, which is mostly fat with some fibrous tissue and skin. And those are the tissues that are actually damaged that cause that change in the shape. And so, you can work out your chest a lot and be healthier and, maybe be a little bit more fit looking. But that change in shape to your breast is just really not something that you can do on your own. And so people ask me, well, okay, is surgery my only option? And I'd say once again that if you want to go with what's best, the answer is yes. I mean, we do have technologies for skin tightening these days, and I have a couple machines in my office that I like. One's a laser and the other is a microneedling with radiofrequency energy, and we do use that for skin tightening. The problem with the breast is that it's not just the skin that has issues, it's also the breast tissue internally. Like the structural component of that breast gets stretched out, and these treatments aren't going to help that.
Yeah.
So, you can use a skin tightener on your breast, and you might gain just a tiny % of tightness, but really you're probably not going to get that outcome that you want. And so when it comes to the breast, unfortunately, it's kind of bad news all around. Like really surgery is kind of the only thing that can help significant changes to the breast.
Yeah, I plan on getting something done, hopefully after I have another kid.
Yeah,
I want another one. So
that brings up a couple of good
Wanna
points, actually. So thank you. First is, when should you kind of look at your body after pregnancy and think, okay, this is what it's going to be, right? Because you get pregnant, you gain the weight, you lose the weight, and then your body goes through changes. Like if your skin gets loose, to a certain degree, it will tighten back up. The fat tissue that you gain does tend to fall off. And so most plastic surgeons would tell you wait like a minimum of 6 months. So you deliver your baby, wait 6 months and kind of see where you're at. And further, like if you're still seeing changes in your body, like you're noticing you're still shedding pounds or skin's changing, then I would wait until that's stabilized.
Yeah.
And then the other point that you brought up is about if you have an issue, when you can have surgery after that. So the big one is like and I'm thinking more along the lines of the breast and breastfeeding. Most people want you to wait 3 to 6 months for that.
Yeah.
If you want to do a procedure.
Yeah, because I breastfed.
Yeah.
And I have implants.
Yeah.
So.
Because you may breastfeed a lot longer than
Yeah.
your delivery date. So it's like, when after that is it safe? So.
Yeah.
So we do have like a quick question.
Yeah.
From Dwight Crownover. He says, do you feel like it is more the woman's thoughts about her self-image of her body, or just society demanding that perfect body?
Well, I think that the answer is yes and yes.
Right.
To both,
yeah.
yeah.
You get people, we are our own worst critics.
Yeah.
I mean, I look at myself in the mirror, and I get nervous, like I'm gaining too much weight. Now, obviously, I'm not a big dude, right?
No.
And so it's kind of like, it's my own kind of like psychosis here, where I'm like looking at myself and being overcritical, and in my profession, talking to people in my office, like I see it all the time.
Yeah.
People will come in and they will have these complaints about their body, and a lot of times I have to, kind of bring them down to reality that, look, you look good, or you look normal. Like if you want to fix something, that's fine, but you shouldn't feel ashamed of how you look, because no one's perfect, right? Like we all have our little flaws. And
like body dysmorphia is such a real thing. Like
totally.
Whenever I got my implants, I got it because one, like I just wanted to.
Sure.
But I didn't depend on it for my happiness. Like I wasn't.
That's right. That's good.
I wasn't like depressed out of my mind because I didn't have a big enough chest.
Yeah.
It was just something like, oh, that's just a cherry on top.
Right.
It wasn't,
Yeah.
It's not supposed to like change your entire life.
And we've talked about that in the past on different episodes about, what is, like, how does the person's, self-image change after surgery? And really, like, the studies all show that if somebody has an issue and they do a surgery to fix it, that it really does improve their both self-esteem and body image. But of course, I feel like that sometimes people get preyed upon, and society does it, like, they make people feel like they have to have this unrealistic expectation. And then there's people who want to profit off of it, even in my own profession, like plastic surgeons or estheticians or whatever, like I don't know, I think sometimes people do get taken advantage of, because I'm not that guy where you come into my office, I'm like, oh, you need this and you need that and you need this. Like, for me, it's like, okay, what are you concerned about? And then let me tell you what your options are. But yeah, I don't know if it's always like that. And it makes me sad, honestly, that, people are held to such high expectations and then, it's almost like coerced into doing these things. Yeah.
I'm lucky I didn't have a plastic surgeon like that.
Yeah, I mean, I know. I'm always critical of my profession, which I think everyone should be critical of their professions, right?
Yeah.
You want your profession
grow.
to be respected,
Yeah.
and you want people in your profession to do the right thing. And so, I'm not sure that always happens in my profession.
Right.
I mean, there are a lot of great plastic surgeons out there. Don't get me wrong, but it's like anything. There's people that aren't the best, no matter what profession it is. So. So the other area that people always ask me about, post-pregnancy or weight gain, weight loss is abdomen.
Yeah.
And this one is super tricky because I get a lot of people that will come to my office and they will be asking about one procedure, and what they really need is something totally different, because there are a lot of things that happen to your abdomen during pregnancy, And not everyone fully understands all of those processes. So the first thing people ask me about is, if I have a little bit of extra fat tissue, can I get rid of that? And this is where I have happy news. Yes, of course, if you have a little bit of extra fat tissue and you hit the gym hard, you watch what you eat, you can definitely lose that. Now, there are limits to that, right? Because genetics plays a part. Some people are predisposed to hold fat tissue more readily than others. So that's one thing. And then age as well, as our metabolism slows down. And I'm going through this now. I used to be able to eat whatever I want and never gain any weight. And I can't do that anymore. I truly have to like diet and exercise now. It's horrible.
Yeah, after I had Avery, my daughter, like, I had to start watching what I ate.
Things change, right? Yeah, totally. Yeah, once again, I feel bad for you girls, because like it's not only do you like you're getting older, but then you're having these things that these pregnancies that really kind of affect you. So anyway, the good news is if you do carry extra fat tissue, generally you can improve that with diet and exercise, and so that is good.
100%.
The next thing is the skin. You know, because what will happen a lot of times is people will deliver their baby, they'll start working out, and then they're just unhappy with how they look, and they'll come into me and they'll say, I delivered my baby, I've been working out for 9 months, I've been working out a year, and things are just not changing. And so I take a look at them, and what their issue is loose skin.
Yeah.
You know, because as you gain weight with a pregnancy, your skin gets stretched out, just like when people gain weight and lose weight, like without pregnancy. And fortunately, our skin does have some ability to snap back. There's a protein called elastin, which, just like it sounds, it's the elastic part of our skin.
Right.
And if you gain some weight and you lose it, you can see that skin make a little bit of a comeback, but there's limits to it. You know, if you gain a lot of weight, you gain it rapidly, you'll get some permanent damage to that skin where it can't come back all the way. So I get women who come in and they're asking, can I fix this problem? And unfortunately, I have to tell them no. Like, if your skin is stretched out and it's kind of past the phase of snapping back, it is what it is. And that can be very frustrating for people. Now, as far as like, do you have to have surgery? No, this is where something like a skin tightening procedure might help. Okay. I'm always a little nervous to push skin tightening procedures because, you know, if you want to compare like skin tightening with surgery versus a machine of some sort, the way I would say is that surgery is very, very predictable. And if I take a knife and I cut away skin and I close it, I can make it whatever I want. You know, if I'm a good artist, which, you know, I hope at this point, I think I am a good artist. With a machine, you're doing a treatment and then you're seeing how the skin's going to react. And so there is definitely a little bit less predictability with that. And for extreme cases of skin stretch, the machine probably is going to fall short. Have you ever done any skin tightening procedures? Probably not. You're young, you're healthy. No?
No, but I mean, I've been interested in it because whenever I was pregnant, my stomach stretched out a lot. Like, I didn't get stretch marks, but that's because I kept putting oil and stuff on my belly whenever I felt like it was itching.
Sure.
So I didn't have any of that, but my stomach is definitely a lot different from whenever I was in my early 20s.
Sure.
And
join the club.
Yeah, so I mean, I think I have that that abdominal thing that you get after you have a kid.
That's it. So that's the next thing we're going to talk about.
Yeah, because my stomach, it's like,
so
I have abs, but it's still like,
you got a pooch.
Pooches out.
Yep.
Yeah.
So that is called rectus diastasis.
Yeah.
And that is and honestly, I'm very impressed that you know about it, and probably because your workout stuff, you know, or have you done research?
Yeah, I've always known about it.
Okay.
Whenever I was done with my pregnancy, I joined like this little mommy, new mom and baby workout thing, and they were always talking about that.
Right.
They're like, don't do this type of abdominal workout because it can cause it to even be like more worse than it was before. So I'm like, oh no. So I've probably been doing all these workouts that I should not be doing because it might be like making it protrude more maybe.
You know, maybe not. We can dive into that a little bit. But I commend you because a lot of people that come to my office are just clueless about rectus diastasis. And so I have to kind of like educate them. And so what rectus diastasis is basically when the abdominal wall, which is that tough layer that separates your inside from your outside, gets stretched out. And people think that, I can fix that by working out. That's not true, because it's not the muscles themselves that get stretched, it's the layers in between. When I do tummy tucks, I open people up. The rectus muscles should be kind of right here on top of each other, and where they're at is like this. And there's this space in between, and it's weaker than those muscles. And what happens? The pressure in your abdomen causes it to pooch out. And unfortunately, that is something you cannot get rid of on your own, and nor is there any treatment like machine-wise that you can do to fix that.
Yeah.
And it's a really frustrating thing for people, and it tends to hit thinner people the most, because thinner people don't have that fat tissue to hide it. People who are a little bit larger oftentimes don't have any idea that they have it. They just think that the diastasis is part of them, maybe needing to lose weight. Thinner people, it becomes a little bit more apparent because they don't have that much fat layer, and you can see women that have like a little pooch, 6 months, a year after they deliver, and that's the diastasis. So that is definitely something where surgery really is the only option to get rid of that.
Yeah.
So, as far as how to prevent it, I mean, it comes back to weight gain. It's that rapid weight gain, during pregnancy that does it. I would say any woman who's had a pregnancy is going to have some degree of it, but it definitely varies a lot. Like a twin pregnancy will crush your abdominal wall in a bad way. You get so stretched out that, when I see patients that have had twins, like they're almost like in a whole nother class as far as like what you have to do to tighten that up.
I should have brought a picture of whenever I was pregnant. Like I was huge, my tummy.
Can I ask you how much weight you gained?
Probably like 40 pounds.
It's not terrible. I mean, you sometimes will hear people gaining, 60, 80 pounds.
Yeah.
And
I wasn't active at all. Like I'm really active now, but I wasn't very active when I was pregnant at all. But luckily I had a lot of muscle memory from being a gymnast for so long.
Yeah.
So I've always had like a stocky build, so it was easy for me to get back into the gym.
Yeah.
But I don't think my abdominal issue is. I think it's more of the. It's not too bad.
It's not too bad. Yeah.
Yeah. So.
Yeah. 40 is like a decent amount. Like my wife, we've had 2 pregnancies, and she gains just the kind of minimum amount. Like not out of trying to do it. She just is kind of a petite person, so she gained like 20, 22, and then 30, I think. She's really lucky. Like she didn't get any of that. Like maybe she has a tiny bit, but it's like kind of undetectable. Yeah.
Yeah.
But it's it's due to how much what her weight gain was. So.
Yeah.
But yeah, it's a very interesting topic. I love when people can fix their own problems. I'm not the guy that's like, oh, surgery is the answer for anything. Like if someone comes in, they got like a little bit extra fat tissue, I'll flat out tell them, hey, you could probably get this on your own if you want. I'm happy to help you if you need that. But unfortunately, a lot of things you can't do on your own.
Yeah.
I feel bad
Just
for you
happens
girls.
that way.
I know, it's the girls too. So, okay, very good. All right. So moving on to the next segment. So this one is hot. This is big news. Now, do you remember the Dr. Death podcast from about 10 years ago?
I don't remember the Dr. Death podcast. It sounds kind of familiar, but I can't say that I just 100% remember it.
So I think that it's safe to say that we have a possible. So and the reason I bring it up is because that was here in Dallas, and now it's like Dallas has maybe a new Dr. Death. Dr. Death 2, not sure. So for the Nip Talk 911, I want to talk about this because this is like all over the news right now. There was a Dr. Ortiz, who is an anesthesiologist here in Dallas, who was just arrested last week. And he was arrested. There's this big investigation. At the same time that he was arrested, the Texas Medical Board came out and suspended his license, and I quote, saying he's a continuing threat to public welfare.
I mean, that picture you just showed of him made him look real creepy.
They always pick the worst pictures, right?
I'm like, we were letting him put people to sleep.
I will say this is all alleged, right? He's not been convicted, but we're reporting, what the news is. And so this all came about because he works at a surgery center here in the Dallas Metroplex, and he is suspected of allegedly tampering with the IV fluid bags that people get during surgery.
Purposely. Yeah, so the article I was reading, I just glanced at it because I was like, this is weird. It was like he was doing something to he was leaving them in a hallway, but he was leaving them somewhere that they were not supposed to be.
No, we
that.
probably read the same article.
Yeah.
I was pulling all the articles about this, and I actually heard about this through people who know, because it's a small world here, I mean, Dallas is a huge metroplex, but the surgery world is not that big.
Right.
And so, I know people who know him, I know people who know situations. So what you're probably reading about is he was seen on video placing bags into a warmer. So so when patients go to surgery, they get IV fluids, and those bags are stored in a warmer because you don't want to put cold fluid into a person because it actually will decrease their body temperature, which can be detrimental.
Right.
So the bags are stored in these IV fluid warmers. Well, the weird part is him putting them in there because the bags are usually stocked by the people who run the OR, not the doctors. And really the doctors generally don't even grab them. So like if we're in surgery and the anesthesiologist who's putting my patient to sleep needs IV fluid bags, they have somebody that'll run and grab them. So you don't usually see the doctors ever messing with them. So what was happening is they were having patients having these bad outcomes in surgery that were unexpected.
Did he cause people to die?
Yes, he did. So there was actually several events at the surgery center that were unexpected. People were having cardiac issues, and no one was sure why. And then what was really the thing that tipped everyone off, there was an anesthesiologist, another one that worked there, a female anesthesiologist. This was happening just a couple months ago. She was sick one day, and so she was dehydrated, and she's like, well, I'm going to go home, and I'm going to give myself some IV fluids, which may sound weird. I mean, when I say that.
No, it doesn't sound weird. I've heard of it before.
Oh, okay, all right. Because sometimes I'll tell people that doctors do that, and I've never done it myself, but like I know plenty of people that have. But it's really common. It's like, if you're dehydrated and you give IV fluids to people, they feel like $1 million, right? So she was sick with something. She took an IV fluid bag from the surgery center, took it home, put the IV in herself, and she immediately died, which is unexpected, right? Like, it's one thing if you have a complication in surgery because the surgery itself is a risk for cardiac issues, right? So when these people were having problems in surgery, no one leapt to the conclusion that, hey, maybe somebody's tampering with these things.
Yeah.
But when a healthy person goes home and takes an IV fluid bag and immediately dies, people start asking questions.
That's intense. I wonder why he was doing that.
We're gonna get to that.
Like, was he being paid to
No.
do that?
that's all right. Hey, so what do you think, Travis? Why do you think he was doing it?
Oh man,
You have any idea?
I did hear that last story that you talked about, where the woman took it home, and she had like a cardiac incident. I don't know why. Like, I couldn't even speculate as to why he did it. Maybe just for experimental purposes. I don't know.
We'll talk about it. I don't want to ruin the surprise. That's going to be the very end. So, all right. But anyway, so the girl died, right? So they do a toxicology report, and she had toxic levels of bupivacaine. So bupivacaine or Marcaine, which is the other name for it, is a drug I use all the time. It's a local anesthetic. So when I do, say, like a trauma surgery and somebody injures their hand, I'll inject bupivacaine around the nerves to deaden them. It's an anesthetic, like Novocaine that you get at the dentist. The problem is that if it gets into your bloodstream, it's very, very toxic. Like, it affects your heart very negatively and can cause your heart to stop. And so what he allegedly did was put this Marcaine or bupivacaine into the IV fluid bags, and then a doctor would grab, or not a doctor, but one of the OR staff would take it to another OR, and the patient would get it, and then they would have the bad problems. And then when the girl took that home and did it to herself at home, where it's not a controlled setting like an OR where you can kind of correct problems like that, she just immediately died. And so when that happened, people started asking questions, and then that's what you were talking about, the video of him putting the bags in. And so then they pulled all the bags out, and they found needle holes in them, and then they found the bupivacaine in the bags. So he was allegedly purposely tampering with these bags, which brings up the question of why. Now, this is something that I heard through the grapevine. It's not, I mean, this is something you won't see in the news anywhere. And what I was told is that the place that he works is what's called an open anesthesia pool, which means at the place I work, the anesthesia is set. Like, it's one group and no one else can come in, okay? But at this place, it could be anyone. And so what I heard is that he was trying to induce bad outcomes for the other doctors so that it would thin the pool of competition for him. So he was doing it to basically get more work. Now, I don't know if that's true. What I heard from sources that...
What a psychopath.
Well, and so that brings up the other thing about his...
Psychopath.
It brings up his history, right? So it's like, was there any tip-off to this, right? So, when something bad happens, everyone asks, like, were there any warning signs? And looking at this guy's history, like, there definitely were. Like, he was convicted of animal cruelty at one point. I think he shot like a neighbor's dog or something, and then he had a couple issues of domestic violence and assault on his record.
So he's just a really cool person. Oh,
Yeah,
man.
definitely I would say there were some warning signs.
Yeah.
And it brings up a lot of
sick.
interesting questions when something happens like this. It's like, okay, how do you prevent something like this from happening in the future? And it's really hard, right? Because it's like the old adage, if somebody, really wants to cause mayhem, it's hard to prevent that. You can take away some easy ways, right? Like you can't go to Walmart and buy like a nuclear bomb, right? But if people are going to get creative, like, you look at the Oklahoma City bomber guy, like he got like fertilizer and diesel and, blew up a building. Like, and of course this is.
Well, most of the time, I feel like people like that are really charismatic, nice, happy people on the outside, and you would never suspect them of being that type of person.
Sometimes, I
And
wonder.
so it's like they get away with stuff like that just because of their.
Could be
Like,
like,
I
they
feel-
like that really strong kind of manipulative personality.
Yeah, what's that murderer dude? That like Ted.
Ted Bundy. Oh
yeah,
yeah.
wasn't he like super charismatic?
Supposedly, yeah. He would
Yeah.
like lure people. Yeah.
Yeah,
I don't know.
sociopath.
Yeah, it brings up a lot of questions, and there's going to be a lot of unpacking of this. And I think because I sit on the medical executive committee for Surgery Center myself, and so I'm sure that the next meeting, we'll be talking about like, do we need to like upguard our safeties or increase our
I
safeties?
bet y'all will.
It's just so hard though because like
Or how do you prevent
to keep
it from
everything
happening?
under lock and key becomes a little bit difficult, So there's just so many things in surgery that could be tampered with that I'm not sure how you would do it. I mean, I think the first thing is that you do have monitoring systems. You have, like, to get into my building, I have to use a key card, right?
Yeah.
So, like, if I go into my building, like, there's a record that occurred. Well, the problem is that I'm expected to be there. But it does prevent somebody from coming in the middle of the night, right? If they see
Yeah.
that Dr. So-and-so came through in the middle of the night and then there was problems, it could trigger an alarm.
I guess the best thing would be just a better vetting system for
Yeah.
allowing somebody
Yeah,
like him to practice. With
So-
those things in his background, like those should have been like,
That's a very, very
maybe
smart
you
thing to
shouldn't
say.
be taking care of people.
Yeah, I mean, that was the big thing that came up with the original Dr. Death. His name was Dr. Dench. He ended up going to prison because
Yeah.
of all of like the bad outcomes he had. And so I can kind of give you some insight into that. The reason that Dr. Dench, the original Dr. Death, was allowed to practice was because people were flat out afraid to be sued. If you go to get privileges in a hospital and you're refused that, like you do have that potential to sue the facility for wrongful failure to allow them to work there, like some sort of, not discrimination like based on, race or sex or anything like that, but like basically, the facility's saying that you're like not worthy to be a doctor and you can take someone to court over that.
Yeah.
And so it becomes a very sticky situation where, yeah, you want to vet people, but it's like, okay, if somebody has something happen to them, is that really like a big warning sign? For this guy, I don't know, he had a lot going on in his past, so.
Scary.
It is scary, right? I mean, it's just, I don't know, there's just bad people out there. And it's hard to protect against it.
Well, that guy looked real weird.
Yeah, it's going
A
to be really.
picture of him.
Well, we'll have to circle back to this because I think that we're going to see, there's going to be a lot of talk about, how can we protect patients better? Because at the end of the day, like, when you run a facility, the ultimate goal is patient safety. Patient safety in surgery and, the things that go along with that. So, very interesting. Crazy
That is
stuff. Wild stuff. All right, so moving on. So I want to do a little bit different segment. We did a different segment last week, the fall
Yes.
fashion, which I love. So we need you to like maybe next week we'll have.
Oh, I have plans.
You guys plans?
Yes.
I'm excited. I can't wait to hear about it. But I want to do a little bit of different segment here. Now that we have a crew that's here every week, and I thought people might want to get to know us a little bit better, and so I want to do like questions about us that we could answer.
Sounds fun.
So Travis, I hope you're ready. I kind of sprung this one on you.
I think I'm ready. I haven't read the questions just yet.
No, you haven't.
Not yet, but I did upload them into the system, so I should have just kind of glanced through them a little bit.
All right, well, I'll go first. I'll give you time to think.
I got you.
All right, let's throw them up. All right, question one. As a kid, what did you want to be when you grew up?
You want me- okay, you go first.
I'll go first. And I'm going to, did you think I wanted to be a doctor?
I don't think so. I bet you didn't.
Yeah, I didn't. And it's funny when I tell you what I wanted to be, there's like a clear reason for it. So I wanted to be a fighter pilot in the military.
Okay.
And you know why I wanted to be a fighter pilot in the military?
Top Gun?
Because I was 10 years old when Top Gun came out. That's the reason I wanted to be a fighter pilot. And I almost did it. That was my plan, and
I could see you with a mustache.
Would I have to have a mustache?
Sure.
And like a big
You
Magnum
would
PI mustache.
100%.
Dude, I look pretty funny with a mustache. Like I do a lot of like dressing up for like Halloween or whatever. Like we go to Scarborough Fair, so I've grown some. I can grow like a wicked beard. Like it's impressive. So I can do it pretty good. I can,
Dr. Bruce Maverick Hermann. That's gonna be the new name.
So I almost did it too. I did get accepted to the U.S. Air Force Academy in Colorado Springs, and the reason I didn't go was because at that time, so that was 1994, there was huge cutbacks to the military during the Clinton years, and I flat out asked them, what are my chances of getting a pilot slot, and they were a little pessimistic about it because of the cutbacks to the military, and also because at the time you had to have perfect vision.
And you couldn't do laser.
Oh, wow.
And I had perfect vision at that time, but all of my family members wear glasses. And I was afraid that I was going to lose it, and then I would go to all that work, and I wouldn't get a pilot slot. So I didn't go. I backed out. So anyway, interesting, I guess.
That's fun, though.
What did you want to be when you were growing up, Sarah?
I wanted to be a dentist.
A dentist? Wow, that's very good. So you just changed your mind? And
Whenever I was little, I don't even remember his name, but my mom would remember his name. He was like one of my favorite people ever. Like he was like
your personal dentist?
Yeah, when I was a kid.
Yeah.
Like I loved going to the dentist.
You love going
Yeah.
to the dentist?
I don't know why, but I
That's
loved
different.
him.
That's
awesome.
super
I
different.
really did. But
It's funny how people like inspire you like that, right? It's
Yeah.
like, your dentist obviously was a very inspiring person.
Yeah, he just seemed so happy and like he got
Loved working on teeth.
Yeah.
Making people happy.
Yeah, so I was like,
Yeah.
I want to be a dentist. This sounds awesome.
Very funny. Travis, what about you, man, growing up?
I think growing up, the one thing I probably wanted to be was a teacher. I think I wanted to be a teacher when I was growing up. I thought that they had like the funnest job ever, and then I realized you had to actually be smart in order to be a teacher, and I was like, yeah, that probably ain't gonna be my travel.
Dude, you have to be smart to run that booth, man. You're
man.
It's like you're operating a
think-
nuclear power plant
appreciate
there.
that.
Number one for teacher, you got to be patient.
Oh, facts. Yeah,
Yeah,
definitely
patience for
facts.
sure.
But I think teacher, that was probably what I wanted to be when I grew up.
Awesome.
Yeah.
All right, what's question 2? I've already forgotten what the questions are now. I have to throw them up there. Oh, do you collect anything?
Okay.
All right. Let me go first.
This is a
Yeah.
good one.
I'll
This
go
is a
first.
good
All
one.
right. So one thing I collect. I collect vintage T-shirts. I have a collection that's overtaken my house. But I have 2 other things I collect. One is sunglasses.
Yes.
I love
The
sunglasses.
sunglasses that you showed me from Colorado, right?
Right, yeah, that's one of the reasons I went to Colorado a couple weeks ago was to buy a pair of sunglasses. And the other thing I collect that you guys probably don't know about, I have a collection of exotic tarantulas in my home.
Like
Exotic
living.
tarantulas?
Yeah.
You have like an ecosystem of
I do.
tarantulas?
Yeah, well, like you have to separate them. So like they each have their own little ecosystem.
Wait,
Would they kill each other?
Yeah, you can't put them together. They'll kill each other. Yeah.
Oh.
do you
But-
take them out and like play
No,
with them?
so the most beautiful ones are extremely venomous. So you have to be really careful. So being a tarantula keeper is a pretty interesting thing because they're fine in their cages. The tricky part is when you want to move them from one cage to the other, because most of the times you buy them and we call them slings, they're spiderlings or baby spiders, and you put them in like an appropriate size container, well, they grow.
Yeah.
And then you have to take them from one to the other. And tarantulas are fast. Like people think spiders are slow. No, they're very quick. And so I have this like whole system of how I get them from one.
What do you feed them?
That was my
Crickets.
next question.
Yeah, crickets.
Are they live crickets?
Yeah, they're live. Yeah.
Oh, wow, that's dope.
I've only seen one. I've seen one tarantula like in the wild. I
Really?
was in the woods and it scared
Man,
the
I should have brought some
crap
pictures
out of me.
because
I was like, why is there a fuzzy thing like moving? Yeah.
I've only seen tarantulas on 8-Legged Freaks. That was an old movie back in the day, I think, called
man.
8-Legged Freaks. I used to love that movie.
I should have brought some pictures because I have some that are just utterly stunningly beautiful and big. Like my biggest one is about that
Oh,
big.
Yeah.
wow.
Yeah,
Now,
Do
that'd
you
be
have
cool.
one named Charlotte?
I don't. That's a good name. I should have done that. I used to name them all, and I eventually quit naming them because, like, when you buy the little babies, they don't always survive, and then I hate naming something and then it croaks.
Well, you should definitely name one Charlotte.
That's great. That's a good idea. Dang, I didn't think of that.
sure.
That's brilliant. When I was thinking of spider names, that one totally escaped me.
That's
all right,
the,
what do you
the
collect,
top
Sarah?
one. I mean, I guess clothes,
Oh, yeah.
shoes.
Clothes and shoes? Yeah.
Yeah. Well, I think mainly shoes.
Shoes?
I would say I have a healthy shoe collection.
If you had to guess, how many shoes would you say you had? Like, just ballpark. That many, golly.
I'd say like 20 pairs.
Okay,
at
that's a good
least.
little bunch.
That's not like an insane amount. That's
Yeah.
not like a hoarder amount where you have
No,
like 500
no,
pairs
like
or
I don't collect them for like and just look at them. Like
Yeah.
I wear them.
Yeah, totally. Yeah.
That's a good bunch.
Travis, you got any collections, man?
So I collect two things actually. It's funny. I collect kind of like Sarah's shoes.
Yeah.
I would say I have probably like 30 pair of shoes.
Now, do you collect like Jordans and stuff like that?
Jordans, Nikes. There's like these overseas like Chinese brands that are like really comfortable and really stylish, but they're more like New Balance style.
I got
guess
you.
would be the way to describe it.
Right on.
And then also like foreign currency.
Really?
Yeah, some of my friends, they like go overseas. I haven't actually been overseas yet, but I have Vietnamese dong, I have Iraqi dinar, and then I have a friend of mine actually right now in Ghana, and they're gonna bring me like some money back basically when they
Nice.
get back. So I have a couple like different foreign currencies that I collect.
Dude, I got something for you. It's sitting on my desk at home. We were in the Bahamas a few weeks ago.
Oh,
and
yeah.
I tried to get rid of all my Bohemian money, but I have a couple of bucks. I'll bring you some.
Please, I will give you the equivalent.
No,
it. I
dude,
love
no.
it. I love foreign money. It's so
man,
cool.
no problem. I'll bring it next week.
I got you.
Awesome. All right, what's our next one? Oh, what's your favorite sporting team? Okay, so
It's a loaded question.
I really have two favorite sports. I
For
love
real.
ice hockey and I love college football. If I had to pick like one favorite team, it'd be the Dallas Stars. Like I'm a big Dallas Stars fan.
I went to go see them when I was little, and I went to see the Stanley Cup when they had it.
You did? Oh,
Yeah, I
that's
got
awesome.
to touch it.
You did, yeah. I actually have a funny story about that. They had the Stanley Cup there one time when I was at a game, and I gave my friend my phone. I said, will you take a picture of me kissing the Stanley Cup? And he's like, yeah, sure. And so I kissed the Stanley Cup, and the guards went nuts.
Oh, wow.
Yeah, you're not allowed to do that. Like, they, like, yelled at me. And so in the picture, like, there's one of me kissing, and the next one's me going like this, because the guards are, like, getting ready to, like, give me a beat down.
I was just a little girl, so they were probably
Okay.
like, whatever.
That's too funny. I was gonna ask you too, Sarah. Like, did you drink out of it? But now that Dr. Herman said he kissed it and they went crazy.
Yeah.
Yeah.
You can't
never
really,
mind.
they don't even want you touching it.
I
Yeah,
believe
I
it.
was like
That's hilarious.
maybe 12.
Oh, yeah, I have tickets. You guys will have to go. I'll give you my tickets.
I
sometime.
love watching
Yeah.
the
Stars
hockey.
fans are like intense. So I went to a couple Stars games last year. They are intense.
Oh, dude, they're great.
Man,
I'll
love
look you
it.
guys up. I have season tickets, so you guys will have to go.
That's dope.
Check it out.
I will
All right,
go.
what's your favorite?
100%.
Oh, see, did
Sarah.
you go? Yeah. Do you have a favorite team? Do you like sports?
Yeah.
Oh, okay.
I love football.
Football.
I mean, I love
College or
the
pros?
Cowboys.
The
but God
Cowboys.
Almighty, like they
No.
like they're just like someday.
Someday.
I feel like that they're always having
God,
problems.
like yes, forever.
Every
for
Cowboys
always,
fan someday.
Yeah.
always and forever.
I'm not like a huge like pro football fan, and
but
like
I love them.
growing up, I was that guy that grew up in Dallas and liked the 49ers.
Oh no.
I was like a Joe Montana. Like I worshiped Joe Montana. I thought he was so cool. And so all my friends hated me because I was like, I mean, I would cheer for the Cowboys, but I would cheer for the 49ers over the Cowboys.
Yeah, like
Wow.
whenever I'm watching football, I'm like, okay, Cowboys first, then Houston,
Houston,
maybe.
yeah.
Sure.
But I definitely love the Rangers too.
Oh yeah, baseball. Yeah, I used
Always
to go.
down for some baseball.
I grew
Yeah.
up whenever Nolan Ryan was pitching for the Rangers.
Yeah.
And so I saw him pitch a few times.
I used to buy that kind of stuff, that memorabilia stuff.
Oh yeah.
Yeah.
Awesome.
Fun fact, I owe my uncle Texas Day Brazil because when the 49ers played the Cowboys last season, we lost, unfortunately, for whatever reason. We lost, miraculously. And we bet
Yeah,
Texas Day
we
Brazil.
never lose.
We
Did
never
you?
lose, right? I bet him Texas Day
Not
Brazil, and now I owe him Texas Day
Oh
Brazil.
no.
I know it. If I had a favorite, well, I do have a favorite sport. My favorite sport is basketball.
Okay.
Okay.
I love basketball, and of course, my favorite team has to be the Mavericks.
The Mavs,
Yeah, I'm a
yeah.
At least
MFFL.
you can have that. Yeah, that's a that's a good,
Yeah.
team.
Yeah.
They actually win.
Yeah, they're good. They're really good.
They
They're
win.
good.
They slightly win.
Yeah, they good.
All right, what's the next one? Let's see. Have you done anything interesting or unique in your life? I'm gonna tell you guys a story. Now this is back in my crazy days.
Uh-oh.
Like it's
All
not
right.
anything bad, but like if I was gonna say something I've done that no one else has done, I just spent a summer in Europe. studying abroad, and I actually went skinny dipping in Loch Ness, which is where the Loch Ness Monster supposedly is. So that's probably the most unique thing I've ever done.
That's scary.
That's funny. One of my favorite movies is called Incident at Loch Ness. It's like
Really?
a document. Have you seen it? Have you
No,
heard of it?
but I'm gonna have to
It's
check
like
it
a
out.
documentary style movie where they investigate the Loch Ness Monster,
Yeah.
but it's very like parody-ish. It's super nice.
Oh,
it's super
is
cool.
it?
Yeah, it's a really good movie though.
So
It's
we
really
went
good.
out there purposely to this town on Loch Ness because they had a Loch Ness Monster museum.
Yeah.
And it was pretty cool. Like, it was really rural, and like, you know, we went down to the loch and met some people, and we were like, all like, oh, let's go swimming in the loch.
That's
and,
so funny.
It's really cold though. It was the middle of the summer, but that lake's really, really deep.
Yeah.
Like, I think it's something like 200 meters deep, which that's really deep for a lake.
Mm-hmm.
And so the water's like freezing cold even in the summer. So yeah, you don't swim in it very long at night.
My
'cause-
goodness.
I would feel so exposed. One, because it's like,
I think that's the point though. Like, it's
Yeah,
the
that's
purpose.
the whole thing, right?
I
To do
know,
something-
but then
to do something crazy.
also you're naked, and then some
Yeah.
creepy monster could come up and be like, done.
That's hilarious.
Fortunately, that didn't happen. But
Facts.
yeah. What? Anything interesting you guys have done?
Sarah?
Honestly, I think the most interesting thing about me or stuff that I do is like what I do now.
Yeah.
Like whenever,
On the media
like
and stuff?
growing up, like pretty normal.
I can see you being like
Person.
pretty good kid.
I was.
Yeah, not getting in trouble.
I never did anything bad. The biggest thing I did was get married at 19. That was the
Oh,
most
wow.
bad thing I did.
That's not
That's
bad.
interesting
It's
though.
just-
That's super interesting.
Yeah, but so far now, I think the most interesting thing about me is that like I own my own business. I do
Yeah.
YouTube, social media,
You are a
all
busy
that
girl.
kind of stuff.
Yeah.
That's
So, and then this is cool.
Yeah.
Absolutely.
This is the most interesting we've done.
Yeah.
Troubles about you, man. Anything cool you've done in your life?
So one interesting thing that I've done, I hopped in a car one time, my car, of course, and I drove 8 hours to New Mexico by myself on like a solo trip, and I didn't tell anybody where I was going until I actually got there. And
Were you
then
going to visit somebody?
No, it was just me just hopping in the car, just going by myself.
Just on a trip, like
Just
a
on
road
a trip, yeah, just
That's
to get away
cool,
from
though.
just to get away from everything and everybody.
Yeah.
This happened. I just turned 30 in July, so this happened for my 30th birthday. I was like, I just want to drive somewhere, and I drove smooth across Texas to New Mexico, and
It's beautiful. Like, it's
You know,
very.
I think
Yeah, it
everybody
is.
has that feeling.
Yeah.
Like, gosh, I
Facts.
just want to like go.
It's like
Yeah.
the wanderlust or whatever it is. Where you're just
Yeah.
like, get
I
out
met a
there.
bunch of cool people. You forced to meet people too when you travel
Yeah.
by yourself. I met
Sure.
a bunch of cool people out in New Mexico.
Dude,
so-
are you gonna do that again, man?
Oh,
Hop in
of
and drop
course,
some-
yeah. And they had some good food out there too. I'm gonna drive somewhere else, but they
Definitely.
had some great food out there too.
That's awesome.
Yeah, facts,
Excellent.
facts.
All right, we'll see. I think we got one or two more. What do we got? Oh, yeah. What do you do for fun on Saturday nights? So my wife and I are big foodies. So we like food and we like music. So like on a Saturday night, like really common for us, we might hit a restaurant, and then we love seeing live music. If there's like a band playing somewhere, we'll definitely check that out.
That's
So.
dope. It's a spot in Deep Ellum called the Freeman. You might check out.
Oh,
it.
I know John J. Myers that
Oh, okay.
owns the Freeman.
Yeah.
Do you know John?
I don't know John, but I know the Freeman, and they have
Yeah.
like really great like vibes out
So yeah, the owner John J. Myers, a guy, and I haven't connected with him in a long time, but he's a good dude. He owns that. He's also a musician, and like
That's
he
cool.
plays in the band there. And yeah, I love Deep Ellum, and the Freeman's really cool.
Yeah,
So
that's
have
dope.
you been there? Checked it out? No, it's pretty
That's
cool.
dope.
Right on.
Yeah.
That is
What do you
cool.
like to do? I know some of the things you like to do.
Yeah.
Because we met like doing
yeah.
like that kind of stuff.
Most of the time, I love to just go out with my friends, just have a good drink here and
Yeah.
there. And then whenever I'm with my kid,
Yeah.
I love to take her to the movies and like do
Oh, awesome.
like games and
Yeah.
stuff.
Sarah's being super modest. Like she has like the most exciting Instagram page and no facts. Like and you have really good photo shoots and angles. But I
She
was like,
does.
who
She's very
takes her
impressive.
pictures? Like I need that person
know,
with
right?
me all the time.
I was actually tapping her brain the other day. It's like, how do I make my stuff look as good as your
Right.
stuff?
It's so creative.
Practice. You just scroll down to the very beginning when I used to just take pictures of my dogs
Yeah.
Oh God.
and just see, like or the sky.
Yeah, yours is
Come so
really
far.
good.
Come so far.
What do you like to do, Travis?
Saturday night. So I actually have another job outside of here. I work for a radio station in the city. So
Do you?
yeah, I work for K104 is the station. So on Saturdays, me and two co-hosts, we actually do our like radio show on Saturday nights. So I don't really get a lot of free time
I'm
on
gonna have
Saturdays.
to check it out. I'm gonna check it
Oh
out,
yeah,
man.
it's called Young Texas. We are on K104, 104.5 in Dallas, Texas.
I will definitely check that out.
I have that station on my car.
Preset, yeah, facts.
I
So,
always
yeah.
have since I was a kid.
Facts.
Since I
Cool.
could drive a
Yeah.
car.
I love K104.
All right, last one. What's something on your bucket list? All right, I'll go first. So this is like way down the line of my bucket list, but I want to go live like for 9 months or a year in like different cities. Like
Oh,
I want to
wow.
live like a year like in Paris or New York City or Tokyo. You know,
That's cool.
Yeah, I would love it. So it's like you want to go to that city and like immerse yourself, like not move there permanently, but like get like an apartment for a year, and just like really experience the city like the way that somebody that lived there full time would. So
That's
I've
dope.
always wanted to do that, and the problem is my job won't allow it.
Yeah.
I have to be retired or do something else.
Be a traveling surgeon.
It's hard. That's a good idea, but it's actually a lot harder than that.
Sure.
You got any bucket lists? You guys are so young. Like you probably.
I
some
have
bucket
a
lists.
lot
Do
of
you? Oh,
bucket
okay.
list things. Like short term, I want to take the girls that work for me at my store, and I want to take them to Las Vegas to the big market that they have there.
Oh, like the fashion market.
Yeah.
Ooh, I
They
bet that'd
have
be
that.
awesome.
And yeah, I've always wanted to go there, but I want to have some goals set at my store first before I do that. But that's
Right.
a short-term goal. But like,
That's awesome.
one of my other ones is to go to France. I've never been there. I've been to Greece. That's the only place that I've been to outside of the United States.
I've never been to Greece, but I do recommend France. Like
Yeah.
Paris is amazing.
Yeah, Greece was awesome.
Yeah,
but
really
I also really like Greek mythology and
Oh,
the
do you?
beach.
I do too.
Yeah.
Like that's just like I'm like nerd out on that Greek mythology
Yeah,
stuff. Yeah,
so
totally.
interesting.
Besides like travel, like I do want to go to like Sweden or like Finland. I've never
Yeah?
seen those places, but I do want to go there. London is also on my bucket list
For sure.
to go to, but I want to do that really soon, like next year.
Do it, man. Now's the time.
I am. But probably my biggest thing on my bucket list is honestly to shake Lil Wayne's hand. I'm a big Lil Wayne fan. I'm a huge Lil Wayne fan.
Dude, we need the show to like go super viral, and then we can have him on as a guest, so we can knock that out.
It's on the way. It's
All
on
right,
the way.
man.
Yes, indeed.
We'll work on
And then
that.
we could talk to him about if he's ever had plastic surgery. Would you ever consider
That would be
having
great,
plastic
man. Lil Wayne needs to
surgery?
be our first guest. That would be awesome.
Thanks.
All right, do we have time for any questions, Travis?
We do.
Okay, what do we got today?
So
Or the Q&A.
Brittany Longo. So we pulled some questions off Instagram
Okay.
and TikTok. Brittany Longo on Instagram. She said, "Are anesthesia complications rare?"
Okay, so in surgery, anesthesia. Well, we just talked about that. Yes, as long as you don't like got Dr. Death, like at your
Right.
place, right?
Yeah.
But no, in all seriousness, anesthesia has become super safe. Like there were times when anesthesia was, carried more risks, and basically what's happened is, our technology's gotten better, our drugs have gotten better, our knowledge of how to prevent problems has gotten better, and so. Yeah, I mean, as long as I've been doing surgery, which is like 20 years, I mean, I can honestly only think of like one of my own patients that had a complication from anesthesia, and it was something where they ended up being totally fine, but unfortunately they had to go into the hospital, unexpectedly to kind of recover from something, but they ended up being fine. So, I mean, I've done thousands upon thousands of surgeries, so, that percentage is very, very low.
Yeah.
Absolutely. Okay. So this next name is kind of funny. Rubbing Buddha's Belly on Instagram.
I love social media names. They're just like all over the place.
They ask, what are your thoughts on skin threading? I think it is.
Yeah, threading. Yeah. So we've talked about it a couple times in the past. So for Sarah, I don't know if you were here when we talked about threading. So it's basically
No,
where they
I think so.
run those like almost like suture material through the skin to like pull it to get rid of wrinkles. Yeah.
No.
It's something that plastic surgeons don't really do. Like most plastic surgeons will tell you not to do it because the results are kind of ho-hum. Like it's not something that doesn't do anything. It does give you some skin tightening, but there's, the downsides are, how effective is it? How long does it last? But then mostly is that you can have some complications from it. And so I'm not a big fan of threading. Like there's other things out there to tighten skin, like we were talking about, like lasers and, Morpheus, which is microneedling.
And those have better results, usually.
Yeah, I would say, I think they're at the very least comparable, if not better, but the risks are lower.
Oh.
Yeah, so,
Yeah.
I'm a low risk kind of guy. Like I don't do risky stuff because why, when you can, make people happy doing things that are not risky. So I'm not a big fan of threading personally. So.
That seems like the best way.
Absolutely. And then the last question we have is actually from TikTok, from the Pandemic is their name on TikTok. Do you ever use leeches on patients?
Leeches, yeah.
Leeches. Oh my
So
gosh.
have you guys heard of that? Leeches in medicine?
I've kind of heard of it,
Yeah.
like kind of in passing, but can you expand on it?
The answer that is, have I ever used leeches is yes, I have used them.
Oh, wow.
So the way plastic surgeons use leeches is when you have some tissue that's engorged with blood. So I can think of 2 reasons that I've used them. Like one is if you do a flap procedure where you move tissue from one area to the other, sometimes the blood flow gets a little off in that tissue and it'll get more blood in than blood can come out. And if it gets too full of blood, it can actually be harmful to that tissue. So you put leeches on it and the leeches draw out the blood. And they're surgical leeches. Like
Right.
you'd get on the internet and you order them and they show up at the hospital the next day and you put them on there. And
That's wild that people, like medical.
it's medical grade leeches. Yeah, that's a
Yeah.
real thing.
that
The other
happens.
thing that you might use them for is like, if you had like say like an ear injury, like where it wasn't like you did surgery on it, but like it got engorged with blood, you could put a leech on there to help draw it
Like
out.
cauliflower ear?
That's a little bit different, but I mean, you're on the kind of the right track. Cauliflower ear is like when the cartilage overgrows. This would be more like if you got like blood in between it or something.
Oh, okay.
But the flaps is the big one. I've used leeches for that. I just don't do that type of surgery much anymore, so I haven't used leeches in years, but I have in the past, and they, to my knowledge, they still are used from time to time.
Wild.
And
Yeah.
then one more comment.
Yeah.
We had a good like couple comments in the comment
Nice.
section today. Dwight Crownover, he said, "Love your talk show. I learn so much every time I watch it."
Oh, thanks,
And
Dwight. We appreciate you watching.
Yeah, exactly. Cindy, she also said, "Lighthouse Art Space off Harwood is the name of the exhibit place."
Lighthouse Art Space off
Yeah,
Harwood.
off Harwood.
Okay,
Yeah,
yeah,
so that was
that's
it.
the one. I
Yes,
think Cindy,
indeed.
that's probably my wife, Cindy.
It is.
Thanks, Cindy. Thanks,
She's
babe.
tuned in.
Thanks, babe. So, all right, well, I think that about wraps up our show.
Yeah.
Please, if you enjoyed the show, please like and subscribe. We really do appreciate that. We thank you so much for watching, and we will catch you next week.